All right, class, welcome to week 3. We are in lecture 1 for week 3, and today's lecture is going to be a bit of a change in plans, and I'll explain all that to you in a moment. We are going to be working on descriptive research versus experimental research. Now, these have synonyms associated with them that you are already familiar with, which is qualitative research and quantitative research. So this is not something new. We know that descriptive research is generally associated with qualitative research, and we know that experimental research is generally associated with quantitative research. So they're very close cousins. In science, we have lots of synonyms. We like to refer to the same items with many different words and synonyms, and that's just the nature of our game. But that is what we are going to focus now as we are starting to move towards looking up some of our own research documents. With the worksheet that you had given to you the day that the librarian spoke with us. So let's move into our first slide here, and let me just kind of take a moment to explain what is going on my end of things. So we're going to rewind just a little bit, and we're not going to rewind too much, but we're going to just refresh our approach to this course a little bit, and I'll explain why that's going to happen momentarily. So we did spend some pretty significant amount of time discussing quantitative and qualitative research. And as we were kind of barreling down last week and the week prior to that, I was focusing more on quantitative research, as that is what I was informed was the purpose of this course. So I'm going to slightly reset a bit today, and we are going to talk about qualitative research. And again, this will be very clear in a few moments. So we're going to also switch what we call these different types of research. So we're going to work on something called descriptive and experimental. And again, very, very similar to what you've already have been exposed to in the previous lectures. So we know that descriptive and experimental research are two very important key concepts or key methods of research. And understanding their differences is going to be essential for many of you as you are new students to research. I did watch your videos. Many of you do not have labs. Many of you have not conducted any type of research whatsoever. Many of you, this is kind of your first introduction to research. So having saw those videos, I really had to pump the brakes because the class is quite diverse in experience. And if we're going to do something right, we're going to do it incredibly accurate, or we're not going to do it at all. So I'm going to reset and explain what these terms are, and I'm doing it purely for your benefit. So as we kind of move backwards a couple of steps, just bear with me. So what is the definition of descriptive research then? So this is research very similar to qualitative. I gave you guys the examples on my last lecture of somebody that goes into a different town in a different city and just sits with the locals and listens to what they say, and they just observe. They're an outside observer who doesn't really interfere with any part of the data collection. So therefore, descriptive research focuses on observing and describing the things that they are seeing occur naturally. This is very, very different than what we talked about with quantitative research. So in descriptive research, the researcher does not manipulate any variables. There is no independent, there is no dependent variable. They just simply sit back and watch, and they collect data to better understand a specific topic. All right, so descriptive research doesn't really have a cause and effect relationship like experimental research does. So if we think about experimental research then, on the other hand, let me give you this example. So think of descriptive research as taking a picture of a situation. And I put this really pretty picture here, right? And if you're the photographer and you take this picture and you capture this image, your job is to just describe what is occurring within this environment, all right? You're capturing the details that are in this environment here. You are not doing anything to interfere with it. You're trying to explain the things as they are happening. So I put an example here. If somebody is smiling in a picture, it's not your job to explain why they're smiling. That would be an experimental research design. You are just simply documenting what is occurring in this picture, okay? And this is very, very different than experimental research, or what we have previously called quantitative research, where this experimental research, on the other hand, this focus is on manipulating variables. And most of the time, we're manipulating several different types of variables. So the researcher in this particular case attempts to control the environment the best as they can, and they will establish the hypothesis to determine a cause and effect relationship. All right, so in this particular one, we are using variables that we're trying to manipulate. We're using a cause and effect relationship. And we usually do this type of research where we divide subjects into different groups, right? One that receives a treatment, one that does not receive a treatment. So very different. And within these groups that we are conducting research on, we manipulate what the groups may receive. All right, so if you want an analogy of that, so in the descriptive research, I said, just tell me what is happening here. It's your job to be an observer. It's your job to watch. It's your job to not interfere with the natural processes, right? But if you wanted to take this picture and turn it into an experimental research, well, what do we have here? We have snow caps, we have mountains. It looks like we have a river of sorts. We have lots of trees. So let's say I am an experimental researcher and I want to now manipulate a variable. And one of those variables I could introduce is I'm going to introduce a match. I'm going to light these trees on fire and see what occurs. I'm manipulating this, right? I'm not descriptively telling you what is happening here. I am manipulating this environment, and I'm going to introduce something to this environment, which would be, in this case, fire, right? And then we would record what happens. And our hypothesis could be, I am going to introduce an intervention here, which is going to be fire. I see that there is a riverbed here that runs through. My hypothesis is there is not enough trees here to cause a big enough inferno to impact the trees over here because of this river, right? So that would be my hypothesis. This would be my experimental group, right? I'm introducing something, and I'm seeing if this experiment, if this fire can cross this river. And I'm hypothesizing that this river is too wide, this fire will not cross. And I hope I'm right, because this is a beautiful landscape, and I wouldn't want to cause any damage to it, right? So the experimental research, very different, cause and effect relationship. And we've spent some time talking about these variables, the independent and the dependent variable. This is going to be very important because as we move into our lit circles, you are going to have to identify independent and dependent variables. And this is usually in the methods section of our research papers that we will be reading, okay? So to give you another example of experimental research, I have an analogy here. I love using analogies. So let's say we wanted to bake this beautiful cake. It looks like we have some raspberries, some blueberries, some figs, lilacs, right? Possibly a buttercream icing there. So in experimental research, think like we're making a cake, right? We have the recipe. The recipe is the experimental group, right? Nothing's assembled yet. I have all of the ingredients for the recipe, and it calls for specific ingredients. So let's say instead of using buttercream, right, or instead of using butter to make this beautiful buttercream, I use applesauce. Let's say I have a vegan and they don't like buttercream, so I have to emulsify applesauce with, let's say, sesame oil, right? I can emulsify that. So I decide to change one of the things, right? I'm controlling the environment because that's what an experimental researcher does. I make some sort of change in a natural environment. Let's say I try to remove sugar, right? And I add, let's say, what's a big thing that bakers are using now? Maple syrup, right? I put maple syrup in it instead of sugar. And I'm going to see how the cake comes out. I'm manipulating the recipe. I'm manipulating the ingredients. So you can read this if you need to. But as an experimental researcher, we take a situation and we start to manipulate the individual pieces that could change this situation. And we're trying to measure and identify what those changes are and the impact of those changes and quantify those changes. Okay, so very different. But again, we are talking essentially about qualitative and quantitative research, but in this case, we are calling it experimental and description. So just hold tight. I'm getting to why we're doing this. So if you want to know what those key differences are, here they are. So we have descriptive research and experimental research. This one focuses on describing. This one focuses on cause and effect. This one we do not manipulate. This one we do manipulate variables, right? So very, very different types of research. In this one, we answer the question, what is happening? And in this one, we answer the question, why is this happening, right? And we try to get at the why by manipulating these variables. And some examples of these methods, and the reason I'm going to give you these examples is because you guys are going to be looking up your own research very soon, and you have to know the types of research that fall under this category, right? So methods that we use in descriptive research are surveys or observations or case studies, right? And again, these are watching, right? A survey is just having somebody tell us what they're experiencing. We're an outsider watching. Observation, we are outsider watching. Case studies, it's another type of descriptive research. And then when we get over here to experimental, we can see that these are very different. Look at controlled experiments, right? We're not controlling anything here. Here we are controlling many variables, right? And we have a treatment group and a control group, or an intervention group and a control group. So one group that is receiving some type of treatment and one group that is not receiving any type of treatment. And the reason we have these two groups is because we want to see what the changes are that occur due to an intervention versus the group that has not received the intervention. Okay, and here is just another way of just kind of seeing these key differences, because I like to beat a dead horse, and I believe that repetition makes perfection. So why then are we hitting this reset button? Well, something remarkable happened this weekend. Kind of blew my mind a little bit, and I was sitting there scratching my head, just kind of wondering, how am I going to explain this to my students that I am currently in a state of shock? So let me explain to you what has occurred over the weekend. Well, I had a chance to watch all of the wonderful videos that you have provided for me in the Dropbox. And while I was going through the videos, I think I got to student number 10, and I began scratching my head saying, okay, hang on a second. I was informed that this course was focusing on nutrition students. I was in communication with nutrition professors. I received information from the other professors that was all solely based around nutrition. I have a pretty extensive nutrition background, so I was like, oh, that makes sense. They want me to do it. It's an easy fit. I can just kind of jump right in. So this course was kind of barreling down the road of let's get nutrition students to understand nutritional research. Well, to my surprise, when I watched the videos, I realized we had no nutrition students in the class. Many of you are in the physical therapy department. Some of you have no experience whatsoever. Some of you are teaching at other institutions. Some of you have conducted research and you're very fluent in the types of research that you had previously conducted. I am not in the realm of physical therapy. I'm just going to throw that out there right now. Many of you are in the PCEPS or the Aspire program. You're focusing on sports psychology. The class is mostly divided evenly between either physical therapy students right here or sports psychologist students. I had one student that mentioned nutrition, and I had two students that mentioned interest in medicine or biomedical sort of science, and this is my world. I'm a biomedical scientist. I look at everything through a microscope. I manipulate variables in cell cultures. I manipulate variables in human beings, and I extract muscle tissue from living human beings to quantify changes to the proteomics or the genomics that are happening in a cell. So I focus a lot on diabetes and biochemical reactions in diabetes, which is vastly, vastly different than physical therapy and sports psychologists. So I need to apologize that as I was teaching the first part of this course, we were focusing primarily on quantitative or experimental research because that is the nature of nutritional and biomedical research. So we were going to go heavy on that end of things. And I kind of disregarded qualitative research because in my world and in the world of nutritional scientists, we don't really use that. We can use, at times we will use both, but the quantitative and the experimental we kind of scale heavier towards that. Sports psychologists, on the other hand, are on the other end of the spectrum predominantly. They use a lot of qualitative research. They do a lot of descriptive research, and physical therapists kind of do a mixed bag. They do both. So I had stopped and scratched my head and said, okay, well, the second week of lectures, I kind of, unbeknowingly to me, missed the most important part for the most represented students in the class. So I am, first of all, a little bit embarrassed because now I have to backtrack, but I am commandeering this class. So what do I mean by that? I am taking it over 100% like a pirate would take over a ship on the open waters. I am not using anything that was given to me. I am not using any of the syllabus that was given to me. I am not using any of the textbook material that was given to me, because if I were to do that and continue in this direction, you would get nothing from this class. And I am here to make sure that your education is personalized and you walk away from this class with something that is meaningful and useful. On my end, that means that there's much more work to be done, but I refuse to do anything half-ass. I've never done that. And as a researcher, you can't do anything 50%. Everything has to be 110%. So I will appreciate your patience as I am recreating this course to meet your needs and not just replicating what has been given to me that has no validity or application to what your needs are as young professionals trying to cross the finish line in academia. So, a couple of quick things. This was the textbook that was given to me. This textbook is absolutely useless at the moment because none of you are in nutrition. So I am going to an older textbook that is conducting and reading research in kinesiology. Kinesiology is an expansive term, which I do believe covers physical therapy and covers a lot of sports psychology. So this book is gone. We are punting it. There it goes. See you later. Now, because this realization was made over the weekend, I have a lot of work to do. There are going to be assigned readings in this textbook where you will have to fill in the gaps of my lectures. I am doing most of the heavy lifting in the lectures, but you have to fill in the gaps because this is going to be personalized, and I'm going to let you go in the direction that you want to go that makes more sense to your career choices. So, first things first, the lecture that I'm presenting on today is covering this material right here, experimental and descriptive research. The PDF for this textbook will be put inside of your Blackboard momentarily. You will have access to it. You are expected to read 8 and 9. Here are the pages. The reason I need you to read these is because I am not going to go through every single type of research design. I'm going to give you the most prominent. I'm going to give you the most used in your field, and I'm also going to give you examples. Okay, so let's now look at some common descriptive research. Okay, and this is more for the sports psychologists and also some of the physical therapists out there based upon the interests that you had expressed in your video. So I'm going to give you some examples and some key phrases and some terms that we can use in PubMed to help us find the research that we might be interested in. Again, some of you may have done this. Most of you have not, based upon what I have seen in the videos. So, well, we're talking about common types of research for sports psychologists. These generally refer to surveys and questionnaires, and we can tell PubMed to find these. These also refer to case studies, right? And these are in-depth exploration of individual athletes' physiological profiles and responses to interventions, right? We can do observational studies. You guys are probably familiar with these. I'm just making sure that you know what to look for as we start to assemble our lit review. If this is something you are interested in, this is the type of research you are going to find in order to write your lit review. If we're doing common descriptive terms for physical therapists, you might see some similarities. Case studies, right? This could be documenting patients' recoveries and their journeys. Cross-sectional studies, that's another type, which is descriptive, and this would be analyzing injury prevalence and movement patterns. One of you had mentioned that you were really interested in movements and falls, so you might want to look at cross-sectional studies. Also surveys, right? And I have some just different examples there that I read about and I typed up for you to help you kind of think about what type of research papers would be most relevant for your inquiries. And if we are doing anything with nutrition, I did try to find some literature out there that would be descriptive in nature. Like I said, in nutrition, there is a bit of a relationship between descriptive and experimental, and these would be food frequency questionnaires when you're collecting what an individual is eating or their dietary habits, dietary logs and records. For examples, when we do muscle biopsies on diabetics, we have to make sure that they keep a 3-day dietary log that explains everything that they are eating prior to us doing the hyperinsulinic euglycemic clamp. We need to make sure that they are following a very strict diet in order to stabilize their blood glucose before we go in and start taking things from within their body, and also cross-sectional studies, right? So these are just basic examples of how descriptive research would work among those three classifications. Now, if we're looking at PubMed and we're trying to find research that focuses on that, well, we could use some keywords like the librarian had explained to us. We could use the key phrase descriptional study or observational study or case study or cross-sectional study or survey. And when we go into PubMed, we can change our filters so that we find these types of articles. And what I did is I took a snapshot. I went into my PubMed and I changed my filters to find observational studies and case reports. And of course, when we look at PubMed, we have the articles on the right-hand side. And you can see that I did some research on those of you who are physical therapists. This one here is Parkinson's disease and movement outcomes. And I did my work. And I went in and I said, okay, do I have case studies? Do I have observational studies? And here you can see observational studies was in the filter. So I clicked that. What else was in there? Descriptive study, I believe, was in there. Nope, case reports right here. Here's another one, case studies or case reports. So I can go into PubMed. I could type these terms, or I could go in there and I can get my filters put on. And that's what helped me find the research that I was looking for. Now, again, there is no right or wrong way to do this. It takes a little bit of time. PubMed and other databases are very finicky. And the research that we look at uses different words to describe the exact same thing. So it takes a little bit of time to hone this in, which is why we're starting this now. Okay, so that was the descriptive side of things. And now let's move over to the experimental side of things. So when we're talking about experimental research, we have very different terms. These are true experimental studies where we are manipulating variables. We are often involve several groups that we randomly assign, right? Participants to a group. I have this group over here. I'm not going to give them anything. They're my control group. And then I have this group over here. They're my experimental group or my intervention group. And I'm going to give them a new drug. And we are going to follow these groups over the course of 8 weeks. We are going to measure, let's say if we're doing drugs, we're going to measure urine, feces, blood, saliva. We're going to get biomarkers. And we're going to see if these biomarkers change their expression over the course of 8 weeks. And obviously the control should have no changes in expression, but we need a group to compare our experimental group to. So that's why we have the control group and we have the experimental group. This is the group that we're giving the new drug to, and we're seeing how much difference in the expression of certain things in the blood or in the saliva or in the urine, how much it increases or decreases compared to the control group. So we will have independent variables and we will have dependent variables. And you did not see that in the descriptive. So some of the things we might see there are field experiments, right? What's a field experiment? Well, this is kind of what I do with the firefighters when I go out into the burning California forests and the mountains, and we just kind of conduct research in the field with these firefighters who are out there for 6 months at a time, and we take their samples, right? In this particular case, the field, the fire, the sleeplessness, the lack of food, these are the variables that are manipulated. And what I'm just doing is collecting snapshots of that by extracting biofluids, and we're measuring how those things change over time. So that would be another type of experimental study where we just kind of go into the field and we take samples, or we can go into the laboratory, right? So these things occur usually in a laboratory, in a clinical setting, or we can go out into the field like we do with the firefighters, and we can take information that we can take biofluids or biomarkers and measure them and quantify them. Remember, we're talking about quantity and quantifying, and that's what experimental research is. And then some common terms that we will see are laboratory experiments, right? These are conducted in a controlled environment. So when we bring people into the lab, let's say we're doing nutritional studies, we bring them into the lab where it's very controlled, and we have an environment that we can control, and then we can interact with those subjects within that controlled environment. And but a laboratory is very different than what we might see in a field experiment, but they all kind of fall under the same banner. And this is why I need you to read those sections, because this lecture would be much, much, much longer if I had to go through all of those. And if it's not relevant to you, there's no sense in going through all of it. Okay. So again, some of the things that we might see with this type of research and experimental research, it's very different than what we saw with descriptive, right? In descriptive, we saw a descriptive study, observational study, case study. I have this picture here because all you're doing is watching. You're just looking and observing and recording what you see. Now, when it comes to experimental design, you can see when we pipette some type of medium into a cell culture here. This is a cell culture dish. We're trying to grow cells and get the cells to do certain things. When we introduce this media, it's going to change the cultural environment, which is going to change how the cells respond. So this would be our intervention, and it's very, very different. We're not just watching, we're intervening, and we're seeing what the cause and the effect in, right? Is if this was bleach, and I put that into the cell culture and the cells were growing wonderfully, and I introduced bleach, what do you think would happen? Well, those cells would probably perish within an hour. So the cause, which is the bleach, and the effect was necrosis or apoptosis, which is cell death. So that's how these are different. So if I go to key terms, if I'm looking at experimental research, I'm going to use things like randomized control trials. And if you read the sections I laid out for you, it will go into a bit more detail as to how these are different, right? But you can see we have controlled trial, we have clinical trial. Usually anything that's done in a clinic is highly controlled. Interventional study, right? This would be an intervention. These cells are growing, they're doing wonderful. I intervene by introducing bleach. Those cells aren't going to be so hot anymore. Experimental study, double-blind, placebo-controlled, crossover study, pre-post study, right? And all of these are always looking at a pre-post. What happened before, what happened in between, and what happened after. And these would be some examples of that research, right? Dietary interventions, nutritional supplements, caloric restriction trials, if we're talking about nutrition. Nutritional bioavailability, feeding trials, right? So if I have a pre and post study and I'm doing a feeding trial, well, what I'm going to do is see where my subjects were pre, put them through the feeding trial. Let's say I'm doing a high protein diet, low carbohydrate diet. Once they go through that intervention, that's my intervention, then post, I want to measure something. It would probably be anthropometrics, right? I want to see if they lost weight. Maybe I'll do some blood samples to see if some of the ghrelin or adiponectin have decreased in the circulation. So these just by nature tell you that they are controlled, they are experimental, there is an intervention, right? And I did the same thing. I went into PubMed and I went to my filters and I found filters that kind of match these types of studies, right? So here's randomized control, clinical trial, intervention study. I went in here. I said, okay, clinical study is there, right? Clinical trial and clinical study are the same thing. Clinical trial, clinical trial protocol, controlled clinical trial, right? Controlled trial. So I just went into PubMed and I put on these filters. So if let's say I were you, right? And a professor gave me a deadline to say, okay, what are your interests in research? What would you like to do? And let's say for me, macronutrient manipulation was something that I was really interested in. Well, I would go into PubMed. I would type that search term into PubMed. Then I would go into my filters and I would say, I want this term, but I only want studies that are clinical studies, clinical trial studies, controlled clinical studies, right? I do not want any observational. Okay, I do not want any reviews. I want clinical studies. So I'd click this, click here. Oh, I got a pen. Let me click it. I don't know why I'm not using it. Let me click my pen. We'll get red. I want clinical study. Check, check, check. No observational studies. Yeah, control. I'll do randomized control. Give me one of those. So now PubMed knows that if I'm looking for macronutrient manipulation papers, I want this, and these types of research designs. And then it will spit out all the results on the right-hand side. So this is how you do that. Now, the reason I'm showing you this is because you will all have different types of designs, right? Sports psychologists might use surveys and questionnaires. So you'll have to tell PubMed to find that for you. Physical therapists might use a combination of both, but these are the studies that might be most prevalent in physical therapy. Biomedical and nutrition would be, if I'm doing descriptive, it would be this, right? But experimental is going to be very different. All right. So you have to choose if you want to focus on descriptive and surveys and questionnaires, or do you want to focus on experimental, where you're looking at primary research where they're using quantitative methods? And that is the nature of the direction we're going to go in, right? But I cannot help further guide you in this until you have met your teammates and you have decided on a research topic. So coming into this meeting, all of you should have a very strong foundation in what I'm presenting on now and what I presented on last week, And again, the only difference is we have qualitative being descriptive and we have quantitative being experimental. So now let's talk a little bit about controls for research. Specifically for experimental research, we have to have controls. Some of you might not look at research that are interested in experimental, but I still need to kind of go over it to make sure that we understand what controls are. Okay, so our control in research is things that we put in place to minimize the influence of external variables. So we want to stop the interference of external variables. And external variables can present themselves in many, many different ways. And we're going to kind of go through just a couple of examples of what external variables might look like. But by controlling these factors or these negative influences, right, that can alter our data set, we can isolate the effect of their influence on our research. Now, again, for this class, you're not really going to do any establishments of control because none of you are conducting primary research, but you need to identify where controls are placed in the research papers that you're reading. And generally, that is discussed in the methods section of the paper. So let's kind of talk about what some of these controls could be. So we can have environmental factors that want to influence our research and influence our results. We could have participant variables. So let me give you a couple examples here on environmental factors. Let's say you are a physical therapist, you're working with athletes. An athlete had a torn Achilles tendon. They had undergone surgery, they had undergone rehabilitation, and now they are out on the track working on developing speed and ground force production once again. You and your team are out there and you would like to see if a particular intervention that you used, which might have been some specific type of rehabilitation style, you want to see what it has done to their speed and their recovery. So let's say it is, let's just pick weather. Let's say it's raining out that day and the surface of the track is slippery, and you still conduct the research. And at the end of the day, you look at your data and you talk to the athlete and you said, oh, how did everything go? And they informed you that due to the weather and due to the slippery surface of the track, that they did not push themselves as hard as they could because they didn't want to re-rupture their injury. And having said that, if you would have controlled for that external influence, which was weather, and moved it to an indoor park or an indoor track, you could have had better results and you didn't waste your entire day standing out in the rain getting results that obviously you can't use because you didn't set controls. If we look at participant age and gender, I'm going to focus on gender. Right now, I'm doing research with the Wildland Firefighters of California, and we're out in the mountains with them collecting all sorts of biofluids. And one of the things we're looking at is the inverse relationship between testosterone and cortisol. Since I'm looking primarily at testosterone, I have to keep gender in mind because we are aware through science that men produce higher levels of testosterone than women do. Women have a naturally very low level of testosterone. So if I group all of them into one big batch, and I see that all the men have high levels of testosterone, and then they drop over the course of fire season, and then I see that the women in the group have low levels of testosterone and they just maintain that same level. Well, now I have data with confounding factors. I have confounding variables because I have two genders mixed together. So one of the things I can do is just say, okay, I will collect the samples from the women, but I will not use them as I am aware that the testosterone levels they produce naturally through their physiology is going to be far lower, and that would be a poor decision to try to measure that and quantify that. Same thing is true for age. Let's say I'm looking at male firefighters ages 18 through 25, And then I'm looking at the leadership of those firefighters who are all in their 40s. Well, we all know that testosterone starts to diminish after the age of 35. It starts to get lower and lower and lower. So maybe I would not want to group all of those samples together in one lump sum, because I'm going to have an influence, a negative influence of age that is going to impact my data. So I have to set controls. So maybe in this study I say, okay, I'm going to set my controls where I'm only looking at men between the ages of 18 and 25. That is a homogeneous group physiologically, and that is all I'm going to study and measure. Therefore, I set controls to eliminate those outside variables that might want to influence my data. Oh, now let's move to another few examples that might represent different types of factors that we have to control for. So let's say we're looking at sleep patterns. Or let's say we're looking at athletes and we want to do cognitive function in athletes. And if a certain intervention we are prescribing is working, but one of the things we have to take notice of is their sleep. Let's say the athletes are in the competitive phase of their sport and they have high stress. They're worrying about their performance. And let's say they're up at night tossing and turning and they're not sleeping. Well, one of the things we might want to do to set controls for our study is say, okay, we are going to bring them in every morning and we are going to ask them how they're feeling, how motivated they are, what their mood is like, and then have they had, how many hours of sleep did they have? And if they say that they had less than 6 hours sleep a night, we remove them from the study from that day and we have them come back and remeasure when the sleep is a bit longer in duration. So sleep can change your results. So we have to control for that, or at least try to recognize it so that we don't take measurements on days where they were not sleeping the night prior. Another one could be time of day for data collection. So I have this sun here. In the research that we do, we need to bring people into the hospital or into the lab or into the clinic as early as possible, especially if we're trying to get basal metabolic measurements. So we would like to get them there before the sun comes up. We bring them there before 5 a.m. and we get them in the bed. We turn off the lights, we turn off the sound, and we get them resting again so that we can do basal resting metabolic rates. If we bring them in any later, let's say we bring them in at 9, let's say we bring them in at 10 a.m., there's all of that time for them to drink coffee or eat food or stimulate themselves in a manner that is going to completely change their metabolism. So if we bring them in early and we get their measurements and then we look at the data and we say, well, that doesn't look right. That's so different than everybody else. Well, then let's say we go into the clinical room and we say, hey, did you eat anything today? And they say, well, I had coffee on the way over. Well, if we didn't control for that and they weren't aware of that, well, then that coffee is going to completely change what we're measuring. So we didn't do a good job of controlling those exterior factors that can influence our data. So here's just a different types of examples that I'm sure you know more about than I do, especially since this is your world, for sports psychology and perhaps physical therapy. So when we put controls into place for description or descriptive research, generally these controls are just to make sure that what we are observing is overlapping with what we had observed in the past. So if we're doing multiple observations, perhaps when they come in, we want to ask them to do a mood test, right? So they come in and we say, hi, how are you feeling? Oh, I feel great. And then they come in day number 2. How are you feeling today? Oh, I feel perfect. I feel great. And then they come in on day number 3 and they're like, yeah, I'm not feeling so hot today. And if we're doing cognitive function or we're doing motivation or we're doing some sort of intervention or we're just observing, well, we know that on day 3, we have a different subject in front of us than we had on day 1 and 2. And we have to make note of that. And that's not to say that we punt the data. That's just to say, okay, well, we're going to start a second pile of data on days they were not feeling so well, and we can probably launch another study off of that data, right? So we want to control for it just to make sure that the person that's showing up for observations is the same person each and every time, right? We could do that with a health questionnaire or a motivational questionnaire. If we're bringing in athletes to see how motivated they are to observe them, well, we want to make sure that that motivation level is pretty succinct with the other days that they had come in. And if not, we could still observe them. We can still collect, that data. But we might want to put that data and that observation in a different pile. And if we're looking at experimental research, these controls are highly controlled. In this particular case, we have a group of people, and let's say all these individuals are suffering from the same type of cancer. Well, let's say we want to do a cause and effect or an interventional study, right? Because that's what experimental research is. We're looking how, if we place an intervention on these individuals, what is the effect of that intervention, right? We're trying to measure why. So if they all have the same type of cancer, we're going to subdivide them into an experimental group and a control group, okay? And the control group means we are not going to give them anything in this particular case. The experimental group, let's say we are going to give them a new drug that is responsible for reducing tumor size, tumor growth, metastasis, and thereby reducing the antibodies in the blood that represent the cancer's presence. So let's say at the beginning of the study, we take everyone's blood sample and we get a mean average of what these antibodies are in the body. And the antibodies that we're measuring, they just indicate that a cancer is present. And let's say after that baseline measurement, we break them into two different groups. We have the experimental group and we have the control group. The control group, we're not going to do anything to. We are going to let them go through the entire duration of this study without receiving any sort of treatment. But the experimental group, we're going to give them an intervention. We are going to give them a new drug that we're testing that is supposed to reduce tumor growth. So we have to develop a hypothesis based upon what we have in front of us. We hypothesize that the control group that is receiving the intervention is going to have a reduced expression of these antibodies, meaning that the cancer is therefore dissipating. And we run them through, let's say, 3 weeks. We take blood samples between each group. 6 weeks, we take blood samples between each group. And after 12 weeks, we take blood samples between each group. And we see that after the 12th week, the experimental group that received the intervention has a reduced expression of these antibodies. They're almost undetectable. So our hypothesis was accurate. We hypothesized that this drug was going to reduce this, and we did a cause-effect intervention, and we see that the cancer is dissipating. But the control group that did not receive that treatment, we see that their antibody levels are higher than ever, which means that the cancer has been growing, and it's been metastasizing. So that is just the kind of differences that exist between these two different styles of research. Now, I just have a few examples here of controls that you might see in your specific field. So if we're doing descriptive research control and we're looking at physical therapy, well, if a physical therapist is conducting descriptive research, and let's say they're looking at patient outcomes after knee surgery, these controls might include this, using the same criteria of measuring recovery. So range of motion, that might be a control. We're not going to do different range of motion tests every time somebody comes in for therapy, right? That would alter our data. So we need to maintain consistency, which will be our variation of control. We also might want to make sure that the participants are all within the same stage of recovery. So we get a group of participants and we make sure that we apply the same method that we're using to measure recovery. And we also make sure that these individuals are in the same stage. So they all come into a cohort 2 weeks after surgery. Then we measure them again 3 weeks after surgery, and then we measure them again 4 weeks after surgery. Those are examples of control that we put into place to make accurate observations. And if we're doing experimental, it's much different. So let's say we're testing a new physical therapy technique, and here are some examples of control. So we could have one group that receives the standard therapy, right? So what has traditionally been done. And we have another group that receives the new physical therapy technique. So in that case, we have a control group, which is receiving the same type of therapy that has been done throughout. And then we have the experimental group where we're taking them out of that therapy that we've always used, and we're applying this new one, and then we're going to see what has occurred as a result. So that's very similar to what I had just shown you with the cancer analogy, right? If we're doing sports psychology, well, again, this is going to be very different. Some descriptive research controls, let's say they're looking at studies in anxiety and how athletes might control their anxiety. Some of the controls that we might want to have are sports levels. So all the participants are the same type of athlete. For example, I work with a lot of MMA fighters. I do strength and conditioning for them. I do a lot of metabolic studies for them. There is a vastly different psyche between an amateur fighter and a pro fighter that has been doing it for a very long time. Amateur fighters, when they get in the cage, when they're walking to the cage, when you're wrapping their hands in the back room, they are terrified. Their hands are shaking. They're not used to all the stimulus. Where if you get a few years into it, you see that the hands stop shaking while you're wrapping their hands. They're much more relaxed. They're much more focused. They're much more confident. They've been in that situation many more times. So if I'm looking at anxiety, and I don't have a homogeneous group, if I have an amateur group who has very high anxiety, and I have a professional group which has very low anxiety, I can't make a statement using both of those groups saying, okay, well, it's a 50-50 split. That's not accurate. I'd have to choose one or the other. And if we were doing experimental research and we wanted to test, let's say, a new mental performance intervention, it would be the same type of thing that we saw with the cancer. We would maybe we would isolate the athletes to the same degree of type of athlete, right? So we would say, okay, our controls are going to be, we're going to look at MMA fighters. And we are going to look at amateur fighters. And we're going to look at amateur fighters that are the ages of 18 to 30, right? So we have these controls to make accurate observations. And then within those two groups, or within the amateur fighter pool, we might give one old intervention to half of them and one new intervention to the other half. And there we have a control and experimental group. And then we can make observations about what we've seen. We could even collect data if we're doing experimental, and we can say that this new intervention caused A, B, C, and D, but we made sure that we had a homogeneous group. So again, I hope by just repeating this all starts to make a lot more sense. And then lastly, if you are looking at nutrition or medical research, I've kind of beat this one with a dead horse, like a dead horse. We can just kind of go back to this one here, right? Highly, highly controlled, cause and effect, dependent and independent variable. And if we want to use descriptive controls, well, then with nutrition, we could use, we can control the eating. That would actually be experimental. We could use food trackers. We could track what they're eating throughout the day and make observations of trends in their diet. We can control factors like age and sex and training intensity if we're looking at exercise. And we're looking at diet. We can make sure that we have women over the age of 40 who have all had children, and we're putting them on a diet and exercise intervention. The observational component would be, we're going to look at the trends that we see in women over 40 that have all had children. Maybe we want to even isolate that even more and say we're going to look at premenopausal. Then we have a homogeneous group. We've controlled for it. And then we can run our experimental procedures on that group.